Hello, everyone, and thank you for tuning in to IFFGD's Research Award winner series titled Where Are They Now? This program was designed not only to acknowledge IFFGD's 30th anniversary this year, but it also gave us a chance to really reconnect and talk with some of our past Research Award winners. So today we actually had the pleasure of speaking with Dr. Koppen, who was our 2019 IFFGD Research Award winner for Pediatric Investigator in Clinical, Basic, and Translational Science. So thank you so much for joining us today, Dr. Koppen.
Thank you for inviting me.
Yeah, so can you tell us a little bit about what you currently do and what you're currently involved in as far as research?
Yes, of course. Currently, I'm still in training to become a pediatrician. In the Dutch healthcare system, it's quite regular to do a PhD before you get into training to specialize. So I'm still finishing up my specialization to become a pediatrician, and I hope to become a pediatric gastroenterologist at some point. And my PhD research was focused on functional constipation in children and other defecation disorders, but mostly functional constipation. And my current research is still focused in that area. I have now supervised one PhD candidate who has successfully received her PhD recently and currently involved in the supervising of another PhD candidate who's doing very interesting work on the same topic.
No, that's awesome. That sounds like some really great things coming forward for you. And so, since winning the IFFGD Research Award, how do you think that has kind of helped you influence or has helped influence your career?
Yes. Well, I think first of all, it was a great honor to receive such recognition. Also, because I have the feeling that the organization is very much focused on the patient group that we actually treat. So I think it's a very patient-focused organization. And to be honest, I think it's until now it is the most the award that I'm the most proud of. Won other awards, but they were mostly focused on research in general or in my field, but mostly from the medical perspective and not from the patient perspective per se. Um, how it has helped me, it's always, I think, as a young researcher, it's very important to receive recognition in order to also make further steps to either acquire funding for future research or to make a name for yourself. Not meaning that it is about me, but in order to be heard, I think it helps um, to have awards such as this recognize your efforts and your research. Also, just to get a bigger stage to get the message out or to acquire funding to do future research. So in that way, it has been very helpful to me.
Yeah, and you made a good point of as far as just the acknowledgments that helps you acquire future fundings for more research. And I think that's very crucial, especially in the GI field and other chronic illnesses as well. It's just having the funds to do the research so that we can better understand these disorders. Can you tell us a little bit about some of the research studies that you're currently working on?
Yes. We're currently working um, basically in three fields, I think, if I would divide it. One is focused on diagnostic tools and especially more advanced diagnostic tools, so focusing on manometry testing, which means anal rectal manometry or colonic manometry, and how to interpret those results or how to use them in further decision making, especially in patients who are therapy resistant. Um, so that's one part of the studies that we do. The other part is mostly focused on what should you do if a patient does not respond well to laxatives only, and you need to do something else. You need to go a step further. What should be the best approach in those patients, and also focusing on a small subset of patients who have a severely impaired quality of life due to their healthcare problems and are not sufficiently helped by the laxatives or the other treatments that we have and who eventually need surgery, which is a small subgroup, but it's a very It's a group that's difficult to treat, and I think we're starting to know more and more about the results of surgery in that group. And then there's another leg of study or another group of studies that we are trying to do, and that's more focused on how to help patients in the outpatient clinic setting by using digital tools. So
Mhm.
how can we also transfer some of the care that is now being provided in hospitals to more lower levels of healthcare? How can we keep patients out of the hospital if it's not necessary for them to come in? And especially in COVID times, which we
Yeah.
are living in right now, digital outpatient care is a very important topic, and we're focusing on that as well, just to see um, can we develop digital tools for patients to help them, but also to alleviate the pressure on the healthcare system.
Yeah, no, and those sound like some really forward-thinking things as well to really help the patient and the quality of life for these patients as well. So, in some of the research studies that you were doing, and you've touched on a little bit of what you hope to gain from them, but what do you hope that you get a general understanding of to better treat any children or adults with constipation?
Yes, I think the first, I described three groups of studies that we're involved in right now. And I think the first two groups of studies, so advanced diagnostics and advanced therapeutics or even surgery, are focused on a patient group that is um, insufficiently helped by regular treatment. So that's one patient group that we hope to gain more knowledge about, and also gain more knowledge about how to treat them well and how to improve their quality of life mostly, because I think that's one of the most important things that we want to improve. We can talk about defecation frequency or other parameters, but uh, in the end, in the end, quality of life is what we aim to improve in these patients. So that's I think one thing that I'm striving towards, and the other thing is indeed is focused on care that is now being provided in hospitals, but perhaps could be provided outside of hospitals as well. So it's actually two ends of the same spectrum. So it's patients who are very difficult to treat and need very advanced care, and patients who may be treated more easily in an outpatient setting without much hospital support. So those are the two groups that we aim
Yeah.
to improve their lives.
Yeah, and really just covering a broad spectrum of the patients as well, and just making sure that no one is missed. And I love that about your research and some of the research that's coming out of your lab. And knowing some of these studies that you have been involved in, what would you consider being your most successful and why?
Yeah, um, that's a good question. I, I don't have one specific study per se. I think that the studies that we've done on surgical outcomes um, are for me one of the projects that I like to work on. Also because surgery is being performed in these patients in different settings, but different surgical approaches are also adhered to. So I think that's a group that we still have a lot to gain when it comes to seeing what helps them. So that's one part of the studies. I think another thing that I'm proud of is especially the manometry studies, but that's also because the collaboration with different centers around the world and with very great expertise from an Australian center with Phil Dinning, and just the fact that all these people are working across borders with the same aim. I think that's maybe one of the. If you ask me now, that might be one of the most the things I'm most proud of. But that also has something to do with the fact that everybody has the same goal, and it's all focused on that.
Yeah, it's all focused on patient care, right? Around the
Yeah,
world,
in the
not
end, it
just
is.
in your local area. That's
Yes.
awesome.
Yeah.
So, and then also you touched, but at the beginning, you touched on some of the other research or just other acknowledgments that you've received in the medical area, not just patient. So what other acknowledgments, if you would like to go into more detail about those acknowledgments, which ones have you received?
There have been awards from Dutch societies, a Dutch society for research in general, which is called in Dutch the KNAW, but the English abbreviation doesn't come up to mind right now. And the Dutch Society for Pediatrics. So those have been awards. And there have been awards from ESPGHAN, for instance, the European Society of Pediatric Gastroenterology, Hepatology, and Nutrition.
Yeah.
And that's also been a travel award that's enabled me to go to the US to collaborate with Carlo Di Lorenzo and his team while working from Amsterdam, being supervised by Mark Benninga and his team. And those awards have also enabled collaboration across borders and have enabled me to go to a specialized motility center to learn more and to perform studies in those patients. So all of these awards together have helped me a lot.
Yeah, and honestly, it's connected you with some senior people in the field of GI, and that's super cool. That's awesome, and that adds a little bit to just the future of the field as well. So that's cool acknowledgments, and congratulations to you for being acknowledged for a lot of the research that you are doing in the field. So in part of being a researcher, obviously there are moments that you probably enjoy the most. And so what are some of those moments that you enjoy about being a researcher and why?
I think one of the most interesting things is when a question comes to mind and you share that question with the team, and the team also think that it's a question that's worth trying to find the answer to, and that together you try to develop the best way to answer that question. It also requires some creativity, but also a lot of teamwork to come to the best strategy to find that solution or find that answer. I think that's the part that I enjoy the most. And then, I mean, the results will be the results. So that's something the only thing you can influence is how you develop your studies or how you set up your studies, and then you need to follow through, and the results will come to you. And that's not something you can influence. But the part before that, where you have a question and you try to design the best available or the best possible study, I think that's the part that I like the most.
Yeah, and it's also part of like answering some of the questions that you know the patients have. So it's
Yeah,
like a sense of fulfillment and knowing that you're helping to answer and provide something for patients to look forward to and
definitely,
some of the research.
definitely. Yeah, definitely.
Yeah. So, in some of the research that we've talked about, and as far as the studies that you have going on, what do you see as being some of the biggest gap needs in the area? And how do you see the future of research being able to fulfill some of those gap needs?
I think one of the major gap needs right now, especially in the center where I work in the Netherlands, I think we now in the digital age that we live in now, I think we are not using digital tools well enough to support these patients and to try to, especially the younger and often less complicated cases of constipation. I think they would benefit a lot from a well-designed digital tool that could sometimes even maybe prevent them having to come to the hospital in the end. So I think there could be a part of it could be prevention, part of it could be outpatient care support, and some of it could be healthcare utilization decrease. And I think that's I think where currently I see the biggest gap um, in general, because it's also the biggest population that we're treating. And the other gap is focused on that other group, that subset of patients who respond insufficiently to current treatments. But that has been a gap for over a while now, and we're trying to get there. And it just requires a lot of effort and a lot of research. But I think that we're going to learn a lot more within the next 5 years about outcomes in those patients. So I know that a lot of effort is being put into that field of research, and I'm not sure yet if the digital tool area is fully yeah fully researched or studied right now. So I think there's the biggest gap.
Yeah, and I think with all of the research, like you said, there is a lot of research going on to just figure out some better treatment options for patients who are suffering from these GI illnesses. And I think just with all the research that's out there, hopefully there's more information to come and good, basically awareness around some of these conditions as well with the research that is coming out. And hopefully with the research, and I'm sure you have other publications out there, hopefully with these research publications will become available so that we can all better understand these GI conditions.
Definitely.
Yeah. So thank you so much for joining us today, Dr. Koppen, and thank you to everyone who has tuned in to IFFGD's new series titled Research Award Winners, Where Are They Now?, where we have taken a moment to really capture some of the research that's going on in currently, as well as just acknowledging all of the great research that Dr. Koppen has done in his lab as well. So thank you again, and thank you everyone for tuning in.
Thank you very much.